Welcome and thank you for standing by. At this time, all participants will be on a listen-only mode until the question and answer session of today's conference. At that time, to ask a question from the phone lines, please press star 1 and unmute your phone and record your name when prompted. This call is being recorded. If you have any objections, please disconnect at this time. I would now like to turn the call over to your host, Aisha Gaskins. You may begin.
Good afternoon, everyone. We welcome you to the webinar APD 101-201. This webinar is being conducted at the request of the NCC-SD Systems Committee and is the second webinar in this series. Today's presenters are Tevlin Thomas and Greg Jordan. We encourage you to ask questions at the end of the presentation. Now, a little bit about our speakers for today. First, Tevlin Thompson. Tevlin Thompson is an IT specialist for the Division of State and Tribal Systems in the Office of Child Support Enforcement. She started as a contractor for the division in 2016 and became a federal employee in 2018. Tevlin approves and disapproves the advanced planning documents submitted by her states. She provides technical assistance in her states in areas of modernization and state systems, independent verification and validation, and conducts certification for states' child support systems. Tevlin has more than 10 years of project management and quality assurance experience in the information, technology, and scientific industries. Next up is Greg Jordan. Greg Jordan is an IT specialist for the Division of State and Tribal Systems under the Office of Child Support Enforcement. He provides recommendations to approve and disapprove advanced planning documents submitted by the states and territories seeking federal financial participation for automated child support enforcement system projects. He also provides technical assistance to states and territories in areas of modernization and statewide systems, independent verification, procurement, and CSES system certification. Greg has worked with the Division of State and Tribal Systems for 19 years. Prior to joining the Division of State and Tribal Systems, he's worked with OCSE's Federal Parent Locator Service and the Federal Tax Refund Offset Unit. First, we will hear from Greg Jordan.
Well, thank you. Good afternoon. That sounds like a long time ago. Tax Refund Offset Unit, now the expanded FPLS. We'll begin with the purpose of this presentation. Today's presentation will provide you with information regarding the, slide 2. Yeah, today's presentation will provide you with information regarding the purpose of the APD, types of APDs, when to submit the APD, Apd content requirements, how and where to submit the APD, and the federal review process for APDs. In addition to providing OCSE with high-level project updates, the APD remains the only vehicle for states to request FFP for automated data processing costs. These costs are reported on lines 4 and 5 of 396. At this point, all states are currently submitting some form of the APD for FFP. Prior to 2010 and the passing of the APD reform rules, states in successful operation and maintenance mode only had in operation maintenance mode only had the option of closing the APD. However, afterward, the OAPD was introduced and closing the APD was no longer an option. Next slide. Types of APDs. There are 3 major types of APD submissions. There's the Planning Apd, used to seek reimbursement for major project planning costs. The Implementation Apd, used to request FFP for major developments such as modernization projects, and the annual APD update, used to update the project status on a routine yearly basis. There's also 2 additional APD updates that we'll talk about later in this slide deck. Those are the as-needed APD update and the operational APD. Guidance for all these APD submissions can be found in the federal regulations under 45 CFR 95-610. Next slide. First, the Planning APD. Although optional, the Planning APD is highly recommended before states begin planning activities for system modernization projects. Planning activities for most modernization projects are inherently complex and considered risky. Therefore, in order not to jeopardize the timely approval of normal legacy system annual APD funding with delays in planning activity approvals, we encourage you to consider submitting this separate planning document. The Planning APD is a brief document, normally about 15 to 30 pages, consisting of a problem statement, a project management plan, an estimated planning budget, and a total cost of the project, or total estimated cost of the project. You may have seen examples already, but there's a template available on the OCSE website below. Next slide. The problem statement of the Planning APD is normally a 1 to 3 page description of either functional deficiencies, technical deficiencies, or both. Below is an example of a problem statement. This excerpt was taken from a problem statement that identifies a system that has outlived its useful life, and the state is seeking a modernization technology solution. Next slide. The project management plan under the planning document. This should include a list of key personnel, an organization chart, a task-oriented list of planning activities, and a commitment to perform a needs assessment. This is where you identify the gaps in the as-needed system and define the to-be system. The requirements definition. Here we're particularly interested in the federal functional requirements definitions. Since all states are currently FSA 88 and Parora certified, we'll need to conduct a system certification compliance review for all full system replacements to validate or ensure that no required functionality is lost in transition. And also, a commitment to perform a feasibility study and alternatives analysis and a cost-benefit analysis. To accomplish these 3 activities, we recommend states use the guidance in the Streamlined Feasibility Study, which will be published in the very near future. Hopefully you'll be able to complete this version of the feasibility study in-house and without the cost of vendor support. If you recall, DSTS announced this effort to simplify the feasibility study process at the OCSE System Symposium in February of 2019, and we followed up to announce the effort in Dear Colleague Letter 1905. Next slide. Other activities under the project management plan include plans for preparing RFPs for vendor services, including the design, development, implementation, or DDI services, quality assurance, or QA services, independent verification and validation, or IVMV services. Just as a note here, the IVMV services must be procured and managed by an entity outside of the Child Support Program's umbrella agency for total independence, free from conflicts of interest regarding project oversight and the reporting to OCSE. Project Management Office, or PMO services, hardware purchasing and installation. Rarely do we see these two costs in this stage, but it's possible. However, there are limitations regarding the purchase of hardware through this vehicle. Also include plans for developing the Iapd. Next slide. Okay. The planning budget should include, well, this section is in reference to the planning budget. The planning budget should include costs broken out by state or federal fiscal quarter and year. This is normally based on the state's budgetary approval cycle and schedule. We've even had states who have calendar year schedules, so either of the three, but in a quarterly breakdown. The budget should include categories or line items such as state and vendor staffing, hardware and software purchases, training, miscellaneous and supplies, and travel. Travel costs normally refers to the state traveling to other states to consider potential transfers. Of course, these costs have been reduced based on new technology such as virtual conferencing like WebEx and Zoom, just to name a couple. Only planning costs should be included in the Planning Apd. You'll still have the normal routine annual Apd update for requesting funding for legacy operations and maintenance, and also minor development activities. Next slide. The total cost estimate. This is a short statement that provides a ballpark estimate of the total planning, development, installation costs and of the new system. Depending on how early in the solution selection process you're in, you may have a vague cost estimate for specific solutions, but of course, by the time feasibility study work is done, you'll have, in most cases, a more realistic and accurate figure. And again, we recommend the use of the streamlined version of the feasibility study to help calculate cost estimates, benefits, and a projected duration of the project. Next slide. The implementation Apd. Before we start this slide, I just want to give some background of where we are right now. Once we've had conference calls and communication back and forth to resolve any potential issues, OCSE will issue a letter approving the feasibility study, setting the frequency of IVMV oversight. In most cases, this will be either quarterly, semi-annually, or full-time. This letter will also encourage you to submit the implementation document. Keep in mind that the Iapd is the only APD that requires prior approval. Once the Iapd is approved, the overall project is approved, and the state can move forward to procure vendor services. For this document, we recommend you roll all previous project cost data and narrative into this one document, including a summary of planning costs, new system development costs based on the results of the feasibility study, and the legacy system operation and maintenance costs. Following approval of the Iapd and the first year of project funding, states can then move forward to submit the annual APD for request for ongoing future project funding. Next slide. Here we have a complete list of required Apd contents. We'll go through each of the following sections in the next few slides. Next slide. The executive summary. The executive summary should include an overview or narrative describing project expectations and goals, a statement of executive support or stakeholder buy-in for the project. Before we can approve the Iapd, the state has to convey to us that there is a state legislative and budgetary commitment to fund the total project costs from beginning to completion. Without this commitment, we cannot approve the Iapd, and therefore there's no commitment from OCSE to provide federal financial participation. Include a summary of the planning phase activities. Include a summary of any requests for waivers. Since APD reform was passed, states can request a waiver for any requirement under 95 CFR 45 subpart F, including waivers for requirements such as prior approval of RFPs and contracts, conflicts of interest, and the use of commercial off-the-shelf software products designed specifically for child support communities. This waiver authority applies to APD requirements only and does not include waivers for program requirements such as those under CFR 45 Part 302 guidance. Those waiver requests should be directed to the regional offices and our policy division. Include a summary of total project costs and a summary of estimated costs for the first year of the project. Here you can cut and paste from the feasibility study. Next slide. The statement of needs and objectives should include a description of the as-is environment or status quo, a description of the to-be system, a definition of the new system's objectives and milestones, and an anticipated benefit or anticipated benefits, all of which can be taken directly from the feasibility study, alternatives analysis, and cost-benefit analysis. Next slide. Results of the feasibility study and inclusion of data in the Iapd. For this section include a high-level discussion of the requirements analysis or gap studies, the alternatives analysis methodology and evaluation criteria used. Our internal review here at OCSE is based on the accuracy, the consistency, measurability, reasonableness, and repeatability of this methodology. In other words, if we repeat the same steps you took using your methodology, we should end up with the same result. Includes solutions considered. Keep in mind that all viable, recently replaced state systems must be considered for transfer, not necessarily chosen as alternatives, but considered. There are some very innovative solutions on the horizon. Maryland and Indiana come to mind. So please be on the lookout. And of course, a thorough description of the selected alternative. Next slide. Include a resource-loaded project schedule that includes a task-oriented project activities, a project schedule by system life cycle phases. In this case, Microsoft Project is an ACF standard. We ask that you include a PDF for those reviewers who may not have access to the Microsoft suite. A resource statement including organization charts, procurements by type and purpose, including any waiver requests, and the scope and nature of the related activities. Next slide. Here we have a sample project schedule, which includes columns for the work breakdown schedule, the task name, and completion status. Next slide. Include interface and security requirements. List and describe each interface with its purpose, frequency, and agencies. States should refer to the System Certification Guide and policy guidance for interfaces linked to the federal system, case referral requirements, and functionality related to case initiation, locate, case management, paternity, establishment, enforcement, financials, security, and reporting. Also describe security requirements, including information regarding the risk analysis, disaster recovery and contingency planning, application security, and include the identification of the program security officer. These requirements can be found in Objective H of the certification guide. Next slide. The implementation budget. Implementation APD budget. The budget line items should have a direct correlation to the project management plan, and each task should be broken out by state staff versus contractor staff. Below is an example of cost categories. Budget spreadsheets must include costs by federal or state fiscal quarter and sum to the total fiscal year costs. Next slide. Here we have a project budget with tasks broken out by quarter and further broken out by state staff and contractor staff. Next slide. Also for the budget, we recommend including a fiscal year budget summary with separate columns for modernization planning, new system development, new system operation and maintenance once installed, and legacy system operations and maintenance. Costs for the life of the system modernization as established in the feasibility study, including costs for the planning phase, development phase, and the first 3 years of O&M. This information can also be cut and pasted from your feasibility study. Also, consider placing prior year legacy data in a separate table or appendix labeled historical data. Next slide. Here we have a sample budget. If you notice, there are summary columns that encapsulate the yearly cost totals for each life cycle phase of the project. First is the planning column. Then we have development and implementation, and maintenance and operations broken down by year. If development costs are being distributed across other agencies, provide a allocated cost by year, program, and FFP rate. An overall cost allocation methodology calculation algorithm used. For these enterprise approaches to system replacement efforts, please refer to the Cost Allocation Methodology Toolkit, which can be found on the OCSE website. Normally, child support is one of the large benefiting agencies, along with child welfare, FNS, and CMS. Also, briefly discuss cost pools affecting overhead, the data center operations, and telecommunications. Next slide. For the inclusion of contracts in the Iapd, include all contracts in the Iapd. We recommend the use of a contract table to report contract information, which we'll see in the next slide. Just as a note, since most, if not all, major modernization projects exceed the $6 million threshold, all procurements are subject to federal prior approval. And include any waivers of prior approval for contracts in narrative accompanying those contract tables. In particular, projects on fast-paced, agile methodology development cycles those states may want to request a waiver for low-risk vendor procurements. This can potentially save time and reduce the risk of project delays. Next slide. Here we have a sample contract table identifying the cost, contract name, type, scope, procurement strategy, and time frame. Next slide.
Okay, this is Tevlyn Thompson. I'm going to be talking about the Apd Updates. So next slide. The Apd Updates, once you have the implementation APD, which is a one-time submittal that you submit to OCSC, then from there you have review of approval prior to the beginning of the development phase. And then after that, the state must submit updates either annually or as needed, and we'll discuss these in the following slides. So next slide, please. There are three different types of APD updates. There's the annual update that's submitted annually. That's provided by the project status updates, continued funding, project funding, implementation costs and benefits, and this will come after the Iapd. Then you will have the as needed. The as needed is basically when you have any changes that's significant. So if you have any significant changes to your schedule, to your calls, then you would submit an as needed. And the last one is operational. It's just operational is where you have no development project. You could have some minor enhancements, but this is basically off of operation and maintenance only. Next slide. So for the annual APD submittal requirements, OCSD is, the submittal is required 60 days after the FFP. And failure to submit in a timely fashion may lead to suspension or IVMB. And when we say suspension or may trigger IVMB, this is not talking about the extensions. Because of COVID-19, quite a few states had asked for an extension, and we granted those extensions based off the reasons why. So this is not talking about, any extensions that were granted. This is talking about not submitting the APD at all with no reason why, the APD was not submitted. So that may lead to a suspension or may trigger an IVMB. Next slide, please. So the APD must include an executive summary, major tasks and milestones, in the organization chart, and this would be changes, any major changes that you may have that you submitted, during your Iapd. So these are just updates, from your Iapd. Also to the initial approval, for any approved changes, baseline against that, and also to an updated project management plan. This would come from your Iapd as well, the updated project management plan that reports on new tasks, tasks that's been completed, changes, any unfinished tasks. Some of my states will have it broken down in sections to where they have a section for the new tasks and then they have a section, for completed tasks to make it easier for us to read. So each state may present it differently, but these are the things that we'll be looking for in the annual APDU. Next slide, please. And this is just an example of the things that I just discussed earlier in the previous slide. It doesn't have to be in this format, but this is what we would like to see, your description. We would like to see description in there. We would like to see the dates we'll like to see the cost and if there's, the current status, if it's completed, ongoing. So these are the things that we would like to see, but like I said, it doesn't have to be in this particular format as long as the information is in there. Next slide, please. Each annual APDU must include the project schedule with the revised completion date for all tasks, include a revised procurement waiver, if applicable, and also to project budget that's reflecting if it's a multi-program, the multi-programs will go through Christy Debt, that Greg had mentioned earlier, which, may include FNS, SNAP, CMS, if it is a multi-program, and would have, the detailing calls to date by the fiscal year, the actuals previously approved by the APD, and the updated budget spreadsheet. Next slide, please. And each APDU must include a contract table, and we'll show you a sample of a contract table. But normally, the contract table will have the vendor's name, the date that the contract started, how long the contract, is for, if there's any optional years, and the baseline, end date. Updates to any remaining sections, such as interfaces and security, and also to most recent biannual APD security review, and this is from 45 CFR 95.621. The biannual APD is totally different than the RS, and we can send out a template that shows exactly what's needed in the APD, and you could go by that template, submit what's needed in the APD, and send that to us. Also, to each year, DFS will have the states to sign to where they've actually have submitted the APD or completed the APD. And even though this is biannual, DSTS have the right to request to see this at any time. Also, too, we would like to see the most recent disaster recovery plan, and also to the risk management plan, and make sure that you have a contingency plan to go, with the risk management plan. And with the disaster recovery plan, we like to make sure that this is, it shows how often that is being tested. Lately, there's been a lot of hurricanes that come through a lot of the states, and some of the states have been hit hard by hurricanes and other disasters. So we just like to make sure that the disaster plan is up to date and that is being tested frequently. Next slide, please. I can move on to the next slide, slide 37. Okay, thank you. The as-needed APD is, like I mentioned earlier, is anything that you have a significant change. So if there's been a significant change in the scope or cost allocation plan methodology, a schedule extension for more than 120 days, or the project cost increase more than $1 million or more, then this will trigger a as-needed APD. and this needs to be submitted no later than 60 days after the occurrence of the change that's being reported. So once you report that significant change, then you have 60 days to submit the as needed. It's due no later than 60 days after that occurrence. Next slide, please. The as needed must contain a revised schedule and budget to show the change in the schedule. It must contain supporting documentation to justify the need of the change. For changing of a schedule or changing of a milestone. And the contract table must be updated with any new, contract. Next slide, please. So here we're getting to the operational APDU. The operational is basically just for operation and maintenance. If you have minor enhancements, you can include those minor enhancements, but anytime that you have a major enhancement, then you can no longer submit operational APDU. You have to go to a regular APDU or annual APDU. So if there are some states that after a while they have to do major development, or they see where they may need to do full replacement of their system, so then they have to switch over from operational APDU to an annual AAPDU. And the operational AAPDU is very short. We have a template, and if Aisha, if you could pull up that template, and just going to kind of walk through that template to make it so you could see exactly what's included in the operational APDU. If you're having problems pulling that up, then I could just kind of walk through what's in the template if you have a hard time pulling it up. Okay, thank you. So there's instructions that tells you, exactly what is needed. Section 1 will have the summary of activities that you will, include in the operational APDU. If you could scroll down. So some of these activities may include, software maintenance, software development activities, which, may not be limited to, the new electronic interfaces, development of graphical user interfaces, application system migration from a mainframe. If you could scroll down. Section 2 will have the summary of the acquisitions. So this information will provide, the type and scope of the contract. And also, too, there's a note there that says operational acquisitions do not require prior approval, regardless of the size of the contract or procurement. If you could scroll down. Section 3 is the annual budget of the operations. Section 4 is the cost allocations, if that's applicable. And keep scrolling down. And part 2 is the actual template that you would actually use. And it has like a table example of the summary of the operational acquisition. So you see a summary here that you could actually go by, a sample to go by. You could scroll down. Section 3 is the annual budget operation activities, and it has a sample of the annual budget that you could use that's broken up into quarters. And the annual budget, will have the state personnel, the contract, hardware purchases, training, overhead, supplies, and other. So it makes it easier for you to just to use a template and just fill out that information. You can scroll down. And then table 3 will have your cost allocation table. So this is, sample the cost allocations. And so, it has it for 4D, for child support. So that's pretty much it for the template. It's pretty straightforward. If you have any questions, you can reach out to your federal analyst on how to, fill out the template. But okay, so slide. Okay. So now this is the summary of the operation maintenance activities. The summary, you describe the activities to show how they are operation and maintenance and activities and not development. So like I said earlier, that's the biggest difference, that there's no development activities. And you have, the corrective changes are tasked to correct minor errors or deficiencies, in the software. Changes or minor revisions or existing software. So these, was considered, operation and maintenance activities. Effective changes or minor improvements to application software. So it will perform in a more efficient, economical, and effective manner. So these are just, the describing the operation and maintenance activities. Next slide, please. So the summary of the acquisitions, you will use the contract table template. And, there in the previous slide, there was a contract table template to where you could actually use that template, and also to provide a list of planned operation maintenance procurement and current operation and maintenance contracts. And that will include, the type and scope of the contract, the procurement strategy, the estimated cost, and the period of performance. Next slide, please. In the annual budget for operations and maintenance, there is a template in there for the annual budget of operation and maintenance. And the annual budget, would consist of expenditures for like the state staff, the contract costs, hardware, training, overhead, miscellaneous, and travel. And I think you saw that, in the template that was just shown a few minutes ago. And also, too, the cost should be broken out by quarter and total for the year. So we always like to see the cost by quarters. Next slide, please. And this is the sample one that's also in the template, where you see that it's broken up by quarters, and then you just fill in the information, for state personnel, training, overhead, supplies, and then you just add up all your totals. Next slide, please. The cost allocation, if this is applicable, then your cost allocation, this is different. The cost allocations for operation and maintenance is different than the cost allocation for development, activities. And if the cost allocations across multiple programs, then you use the methodology that's provided by, Christy Dant in her department for the multi-programs. And you also need to include a section indicating the approved cost allocation percentage for each program involved. Next slide, please. And this is just a sample of the cost allocation where we have it for the 4D for child support, and this is also included in the template, so to make it easier, for you to use. So pretty much all of this is in the template that was shown earlier. Next slide, please. So this is the submission process. The submission process, a cover letter must be included. Cover letter is mandatory. We cannot get started unless we have a cover letter. Cover letters should be addressed to the commissioner, and also to the cover letter should include the amount that you're requesting. So if it is a APDU and you have amount for development and then you have a separate amount for operation and maintenance, both of those should be in the cover letter to say this is the amount for development, this is the amount for operations and maintenance, and this is the total amount for both that we're requesting. If it's just for operation and maintenance, then you could just, make sure you have the amount that you're requesting for operation and maintenance. Because the cover letter, this is the commissioner sees the cover letter. The commissioner does not see the actual AAPDU or OAPDU. So the commissioner will have no idea the amount that you're requesting unless it's in the cover letter, because they're not going to get the detailed information and look, through all that information to find, figure out the amount that you're requesting. So we'd like to have that in the cover letter. The letter must be signed and dated by the state 4D director. And, if it's not the state 4D director, if the state 4D director have left and you have an acting 4D director, then it could be signed, by the acting 4D director or whoever is in charge during that time, because this is on recorded as an approved requester. So I'll need to make sure we have the correct person signing the cover letter. Next slide, please. And if it is a multi-program, then this is the address that you go to for the multi-program. I mentioned earlier that Christy Dant is the coordinator for the multi-program, so that goes to a different office. And it must be signed and dated by the appropriate, state official. Next slide, please. Electronic submittal. Because of the pandemic, we're doing mostly electronic submittals because a lot of people are not in the office to get, the hard copies. So you could send the electronic submittals to the DSTS mailbox, and we will receive that on our end. We have somebody to monitor the mailbox at all times. And if it's for a multi-program, then they have their separate mailbox that you can send it to for multi-program. Next slide, please. And if the files are too large to be sent, then you could work with us, with any of the federal analysts, and we could work with you on how to submit, the large files. A lot of times the states would submit it in a zip file, and so far we haven't had problems, having large files in a zip file. But, for some reason, we do have problems receiving a large file, or you have problems submitting a large file, then we'll work with you on how to submit those. Once we receive the information, then OCSC would send out an acknowledgement letter stating that we did receive and the date that we received it. And that would go to the state. Next slide, please. So approvals of the APDs. Once everything has been approved, either your AAPDU, your as needed, or your operational APD, then you receive a response letter that's signed by the commissioner or the deputy commissioner. One of the two will sign the response letter to let you know that it has been approved. And if it's for a multi-program, then it would be signed by the Deputy Assistant Secretary that will let you know that it has been approved. Then ACF response will either grant approval with or without conditions. We could also disapprove the request, or we could defer decisions pending submission, if there's additional information that's needed. So there's additional information that's needed. We will let you know what information is needed and when it's needed, and have, a date for you to submit that information. We could also provide decision on the state's request for a waiver or prior approval, if it's for contracts and RFPs. So those are some of the approvals for the APDs. Next slide, please. So the approval for a decision letter, if this document is approved, then it was, is usually on 1 year, and in the letter we would say that the next one is due. Mostly of the federal fiscal year are due, by August the 1st. So for like August the 1st of 2021 will be the next one that's due. But then if it's on the state fiscal year, then in the response letter, it will have when the next one is due for your state fiscal year. In the approval decision, you will have the approval amount and the term, usually, 1 year. It would tell you the adjustments that's been made. It would either be a negative adjustment or either a positive adjustment. and it would tell you what year that adjustment was made. Sometimes the adjustments goes out 2 years because we don't have all of the actuals in. So depends on how the state's actuals are reported. It depends on when the adjustments are. The adjustments could be for just one prior year, or like I said earlier, it could go out to 2 years because they're estimates and not actuals, and we have to go by when all the actuals are in. If the state requests a waiver for prior approval of any contract in the APD, then approval decision letter will also be provided in there. And if there's more information needed, OCSC, defers approval or conditional approves depending on the submission of the information. So we could, do a conditional approval based off of, once we receive, we conditionally approve this APDU, but we would need this information, in order for it to be approved. So it will only be a conditional approved until we receive that information. Next slide, please. Provisional approval. If no written response from OCSC is received by the state within 60 days, so if there's no response from us within 60 days, then it is considered provisionally approved from that 61st day. And this is per the regulations 45 CFR 95.66611D. This means that the state can proceed with the project at the state's own risk without waiting on HHS written approval. But once HHS approves the project, then it's eligible for funding from the date of the provisional approval. However, if the approval is deferred, then the APD is disapproved from the date of the provisional approval, and it's no longer applicable. Next slide, please. So an APD could be or may be disapproved if it ceased to comply, the computerized support enforcement system ceased to comply with the APD. Is not enough resources allocated to the project, or is poor, inadequate project management, ill-conceived project plan, budget and cover letter and APD budgets do not agree. Most of the time, if the budget and the cover letter and APD budgets do not agree, most of my states will either make the change either in the cover letter or they'll make the change in the APD. So those two can match. So most of the time, my states, I have no problems with them making those changes. Also, too, another disapproval can be required IVND assessment is not complete. So these are some of the reasons why, we may disapprove APD. Next slide, please. When OCSC disapproves the APD, then the project is suspended. The previously approved FFP for the project ceases for the entire period of the suspension of the APD, and no additional FFP will be approved until the APD is reauthorized. Next slide, please. So waivers of the APD. So waiver of APD requires, it provides a waiver process for any APD requirement. It must demonstrate why meeting regulatory provision is unnecessary or inappropriate. It will ensure the state and federal interests are addressed, and waivers approach can be all or portion of the APD's regulatory provisions. Next slide. And also to waiver or APD requirements will review assurance that all processes provided and efficient program operation. If a waiver is approved, then the waiver becomes a part of the state's APD, and the states must have IVMD assessment to determine the degree of the IVMD needed. If disapproved, then the entire APD would be disapproved, and disapproval of a final administration decision is not subject to administrative appeal. And I'm going to ask my counterpart, Greg Jordan, if he could go into a little bit more detail of the waiver requirements.
I just wanted to add one thing here. This waiver and the associated oversight procedures refer to alternative system configurations. We currently have no states under a waiver for an alternative system configuration. All states are statewide, one single system certified.
Okay, thank you, Greg. Next slide, please. So here we just have references. This make it easier for you to find out where a lot of information is located. Most of this is in the Title 45 Public Welfare and Human Services Code, either in Part 307, Part 92, or either in Part 95. Next slide, please. These are some additional references to make it easier to you to find, some of the information. And if you have, any questions, you could get, with your federal analyst. But I just wanted to provide you a list of references. Next slide, please. And this should be the last slide of references here. We also, the last bullet included the Dear Colleague letter, which is about the streamlined feasibility study, which is streamlined feasibility study that should be completed soon and should be released soon. But this is the Dear Colleague letter that went out earlier. This concludes our presentation. So if there's any questions, I guess the operator could open it up to any questions that you may have during this time. Operator, are you?
Yes, ma'am. It'll just be one moment.
Okay, thank you.
Sure. We'll now begin a question and answer session. To ask a question from the phone lines, please press *1. Ensure your phone is unmuted and record your name at the prompt. Name is required to introduce your question. If your question has been answered and you would like to withdraw that question, please press *2. You also have the option of using the Q&A function on the webinar to ask your question. Questions from the
and
phone
also,
line.
too, there's a Q&A section that you could type in your questions as well. So if you have any questions, feel free to type it in the Q&A, and we'll be monitoring the Q&A session for any questions as well.
This is Raghavan here. When you type a question in the chat box, please address it to the all panelists. Select it from the drop-down and select all panelists so that it will go to either one of us.
Raghavan, this is the operator. I do see that there are a few questions in regards to if the slide deck will be available for callers.
Yes, the slide deck will be made available after the presentation, and either we can send it to all the participants or it will be uploaded onto the ACF website.
I do see another question answer. It says, good morning. Thank you for the presentation. Instead of having the states have to inquire, can you add those specific sample templates to the website?
So the sample templates are already available on the website. So as a quick reference, we provided that link onto the PowerPoint presentation, but we'll be happy to send to you in a separate email or whichever mode you prefer.
I see another one that says, can you provide examples of major change that would necessitate an update? So I'm assuming this, when you said major change, is it speaking about the operational OAPD? I just want to get clarification.
It may also refer to an as needed, as you had mentioned in your presentation.
Yes.
So,
yes, as needed.
Yeah, I think we need more clarification on what type of APD updates that you're talking about, Kate.
Yeah, because
as needed.
I'm sorry, did someone say something?
Yeah, here I think we're looking at a major increase in cost. If you have your normal APD approved and there's additional activities that were not included in that document, there are significant development activities possibly related to contracts, you may want to send in a request for additional funding through that funding cycle. Yeah, I can't think of any major changes. I think our rule is 20% of contract costs if it's increased, and then the as needed, and you may need to get approval of the contract amendment. I'm not sure, but in cases of the as needed, we also ask for the as needed in cases where you want to update us on maybe some of the state plan activities, which have timelines also. We've asked states to submit as needed for that purpose, just to to convey to policy that those activities are underway or have been completed.
Okay, because they said that the focus is on the cost more than on functionality. So they're looking at an answer more focused on the cost than the functionality. So I think we said if the cost, if there's the major increase in cost, then we have to submit a as needed.
Yeah, especially if there's a change in scope. Normally, if you have an increase in cost, you would just send us actuals at the end of the cycle. We can adjust the approved amount to increase the amount of reimbursement. But if there's a change in scope and we didn't have that information in our documentation, or there's possibly a $6 million threshold for prior approval that you're about to hit, of course we would want the contract. That requires prior approval, and we would like to get an as needed to receive the funding. But for normal operations and maintenance, that's not a problem. There's no as needed required. This would be mainly for developmental type activities out of the normal scope of your APD.
Okay. Have another question that says, have you received any lessons learned from states currently in their replacement process? Arizona is early on in their process, but they would like to be appreciative of any lessons learned.
We have, I can't think of any lessons learned that we have, but we have seen drastic improvements in documentation and some innovative approaches. Indiana, for one, submitted a fantastic APD or Iapd, encapsulating all of their planning activities and development throughout the upcoming project or project that they're in now. To the end of the project, they're using a COTS-based product. It's not necessarily a COTS. We own the intellectual the data and the improvements. So it's not a COTS out of the box product, but that's a project that you might want to look at, particularly for the approach using an accelerator to speed up the project, and for documentation also. Maryland also, very interesting system. You may want to touch base with the Maryland team if you're looking for a new approach to system modernization.
And this is Raghavan here. I just want to let you all know that, time and again, we share that kind of information, and we also provide a platform to all the states to, share all this information. If you recall, I think back in February 2019, we had several states showcase their, replacement modernization process, and also talk about, their experiences on the modernization process and the lessons learned. So probably, I think, in 2021, we may have a similar, platform for the states that have modernized and, share such information.
Yes, this is Greg. I would also like to mention the state of Maryland. They submitted one of the tables for low-risk activities that they procure off of a state master contract for waivers of prior approval. Normally, any acquisition is subject to prior approval, so that's 30 days at least for us, or 60 days for us to review the RFP and then the contract. That's one lesson there that we learned, that if you submit that waiver request and you have an agile system that's fast-paced, there's a possibility that if you put enough information in your APD describing your activities and they're low risk, we can waive that timeline for our approval and let you proceed to procure from at least one of those master contracts, either master contract or if you put it on the street. But particularly in Maryland's case, it's a state master contract.
Okay. Do have another question in the chat that asks, are you able to share Indiana Iapd with other states?
I believe so. I've had one request already. I mentioned it to the state. I'll run it past them one more time, and if you give me your state, I can reach out to Indiana and find out or pass their contact information to you. I'm sure they will be happy to share any information they have.
Okay, this came from Astra Courtesy.
Okay.
Okay.
Operator, do we have any questions on the phone?
There are no questions from the phone lines.
Okay.
And I think it's Ricky, R-I-K-I. Last name is M-A-I-O. Is also interested in Indiana Iapd. He's from Arizona.
Okay, I'll reach out to Indiana, and if there's anything I need to redact, I'll take care of that and forward it along to you, or you can reach out to Indiana. I'll follow up with contact information.
Okay, yeah, because South Dakota, Shannon Abernathy is also interested in a copy of Indiana's Iapd, well, if they're willing to share. So we have quite a few that's interested. Okay. Those the only ones I'm looking through just to make sure I haven't missed any through the chat so far. I don't see any more. Oops, wait a minute. Darren Steele, Virginia would like a copy of Indiana's as well. So are we keeping track of who would like a copy of Indiana's? Make sure or are we asking them to reach out?
Sure. I think I have noted down the participants that have asked for
Okay.
the Iapd of Indiana. But in case we missed you, just send out an email to your federal analyst, and we'll be glad to send whatever we send it to the other states. Of course, after Greg talks to Indiana and redacts the information that we need to redact. So we'll be happy to send it to you.
Okay, thank you. I don't see any more questions.
Okay, since we don't have any more questions, so in case any question pops up in your mind after this session is over, you may send it to your federal analyst, or you can send it to the common DSTS mailbox, ocsc.dsts@acf.hhs.gov. That's email box is being monitored every day, and you can send your questions about this presentation or any other questions that you may have about the whole process or anything else. So thank you for your participation, and we'll be in touch shortly with the Iapd of Indiana and send it to you all. Thank you.
Thank you.
Participation. You may disconnect your lines at this time.